Now I see a sign that says, this is a plant-based food. I think I'm doing good. I went to a fast food restaurant because that's all I can afford. I picked the thing that says it was going to be plant-based. So part of the challenge we have is there's a cultural shift. And what we're really trying to get people to do is realize the basics are the basics. And the basics are still some of the best options we have. So in kidney disease, the fact that sleep makes such an important part of this, and you want to be able to encourage patients to get 7 to 9 hours of sleep, to get that sleep hygiene going, to get that regimen going. We underplay the impact of just 5 to 10 minutes of walking. If you make a mistake and you eat something bad, listen, go out for a quick walk. Right? Nobody's perfect. We're not going to fault you to say, oh my God, you made that mistake. Instead, what we're going to say is 9 out of 10 times you did so great. And when you do fall down, don't stay down. Stand back up and make a better decision to do that. So exercise makes such a difference. When we look at the concept of connection, of social connection, most of our folks who are going through illnesses, unfortunately, they're battling it alone. And as healthcare providers, what we do is we come into their lives for 10 minutes, for 15 minutes every 3 months, and then we go out of their lives. But what we forget is that the 99.9% of the time, they may be battling alone. They may not have any resources. So there's this idea of social isolation. And how do you get over that? How do you bring people together? How do you create relationships and foster? Because what we know is that when you're stressed, you resort to whatever is the easiest and weakest part of you. So for some people, when they're stressed, they go and smoke. Some people, when they're stressed, they go and do whatever the junk food is. And then for food-wise, what we talk about is quality. Quality of food matters. You know, if you're getting food and you're trying to do the right thing, what we want to be able to do is not shame you, but instead support you by trying to make it easier. How do you take very simple, very inexpensive things, put them together to make a healthy meal for your family? So when we talk about the main causes of kidney disease, we know that main causes wise, they're preventable. Even when we start to get into things that are genetic, there's so much that you can do to slow down that course. So if there's anything that your listeners tonight can take home is, number one, don't lose hope. Number two is don't go for the hype. Don't let people tell you that you're going to get this magical answer, but look at the part of how do you make progress over perfection. And if you mess up, it's okay. And ignore everybody on Instagram who's saying, you know, I did X and I'm now 200 pounds lighter, or I did Y and I cured my kidney disease. Instagram does not share our failures. It doesn't. Nobody goes there to say, today I messed up. Tomorrow I still messed up. And the day after I still messed up. Because if you did that, you wouldn't get followers from it. So part of this is there's a reality of it. There's compassion to this. There's caring to this. And it's all about that human connection that we all need to emphasize over the idea of my way is somehow better than the next guy's way, because all of that stuff means nothing to the member. Absolutely nothing.
So out of the last 1,000 patients that you have seen, what % of them had chronic kidney disease but didn't have diabetes or obesity?
I don't know that percentage, Dr. Hashmi. You may.
I just a guess, like how often does that happen?
Yeah, so the majority of my practice is diabetes, is obesity, it's high blood pressure. And so if I had to, make a educated guess based on the last 14 years of doing this, I would say probably a good 80% of my patients have preventable causes. And then the 20% that are left over are the ones where we're doing biopsies, we're looking for genetic causes, we're looking for other things where it's a very different pathway. But a good 80% is where I know that if I can get those folks to just stand next to me and see where they're at in life, we can make so much work, so much change.
Yeah, my dad
Yeah,
died.
I would, if I had to just pull a number, I mean, that's kind of a hard thing to answer, but yes, I mean, most of things like the genetic conditions are considered rare disease. So the primary causes diabetes and hypertension, and, you know, along with that usually goes obesity. So, but like Dr. Hashmi said, no matter what, there's still hope for whatever the cause is. There is still hope. And another thing I really that I think we need to bring, when he was talking about like community and needing help, it's also important that, especially if you're working with the dietitian, like kind of ongoing coaching. So I have patients that, you know, they know they've learned what to do, like we've taught them what to do, but they still need, maybe they don't have a social structure. They still need, sometimes they just need me just to talk to me once a week, you know, just to be their support, to encourage, to be that voice that hears them, and helps them with things maybe that they struggled with. And so I would encourage that ongoing coaching. Sometimes that can be unaffordable. And at that point, you know, finding community resources, social workers can help with that sort of thing, just finding some sort of support group, a church, anything, just to have something to kind of hold you up as you're walking through this, because it's hard. Chronic disease is hard. And, you know, a lot of times, like with other chronic diseases, going back to how we started, you know, with, say, cancer, and people go through cancer treatment and they say, oh, you're in remission. Okay, with kidney disease, it's something you have to stay on top of forever. So you need an ongoing support system. You need ongoing social surroundings to help you get you up when you get down, because it's a hard thing to deal with. And so I love to encourage my patients to have community, and you know, it's not just diet, just exercise. There's so many other things, just being a whole human who happens to have kidney damage.
Yeah, when my dad passed away about 4 years ago from chronic kidney disease, and every now and then I would butt into with the doctors and my family and suggest something about diet, and everyone yelled at me and told me to, you know, don't get out of the way, Stephen, you're being ridiculous. But is this not, what you're saying not considered known about how diet and lifestyle affects kidney disease? Is this secret information, or did the most kidney specialists know this?
In my experience, no, they do not. I mean, so that's the whole, so I wrote the first, I actually just published a second book. I wrote the first book, Plant-Fed Kidneys, because I felt like I need to raise awareness. People are not aware that nutritionally you can do something to slow progression. And then patients read it. It was really more for practitioners trying to raise awareness. So I wrote a second one that just came out called Plant-Fed Kidneys for the patient, because patients wanted recipes and more support. But that's the reason I wrote that. And that's the reason I do a lot of public speaking. A lot of the nephrologists, they still, even if they're in, say, in value-based care, is trying to change this. It's trying to make the pre-end stage, the pre-dialysis space, more multidisciplinary. Even there, nephrologists aren't referring to dietitians, and I don't understand why. They're not all like Dr. Hashmi or Dr. Shivam Joshi from New York. Those are wonderful, but there's a lot. We still need more education. We still need to talk to doctors so that they know, and we need to educate patients as well. But I'm be honest, I think the patients are ahead of the doctors, and that is why they're out on Instagram looking. They're searching. That I hardly ever have to go hunting for patients. They find me. And so I think, you know, our medical teams need to get up to speed, and let's start helping these patients avoid that dialysis chair.
Okay, there was a book that came out by just recently, and I think in the last, you know, few months, by Sally Norton, called Toxic Superfoods: How Oxalate Overload is Making You Sick, and how to get better. She says that beans, quinoa, and whole grains are gut irritating foods, and green vegetables. Okay, so yeah, and green vegetables. So are oxalates bad for our kidneys? Could we get ourselves in trouble by having too many green vegetables or too many whole food plant-based? Is this something to be concerned about. I don't want kidney stones. I don't want kidney disease. What do you make of this?
Well, it's funny that you bring up this topic because, when we start to talk about things like beans are going to kill you and oxalates are going to kill you, there are entire continents that should frankly be dead if you truly believe in this idea. And this is fascinating, right? If you talk about kidney stones, the first thing we do in kidney stones, there's actually very simple things you have to do. Let's take calcium oxalate, most common type of kidney stone. You don't put them on a low oxalate diet. And these are calcium oxalate stones. So the first thing you actually do is you tell them that as you're eating vegetables, fruits, etc., you want to pick products that are actually going to have higher content of calcium in them. You don't want them to take calcium supplements, but you actually want to increase calcium-rich foods. And the reason you do that is the calcium that goes inside your gut will actually bind to the oxalate. And then you'll get rid of it when you go to the bathroom. Preventing kidney stones is water, water, water. That's the number one way, because at the end of the day, if you look at a stream versus a pond, how does a kidney stone form? It forms because debris collects and then it turns into a stone. If you don't want debris to collect, don't let it sit there. And how do you not let it sit there? Keep drinking water and keep having the flow.